Hello everyone, I'm Dr. Deepthi Karia and today we'll discuss about functions of white blood cells. Before starting my class, I would like to inform you all that you will get all my lecture notes in soft copy and hard copy. To get the soft copy, you have to download the application WBCS from the Play Store and you have to get the subscription. And for hard copy, you can order my book that is Physiology Notes, which is also available on Flipkart and Amazon. Link for the book as well as link for the application that is given in the description box. Now, let us start with the today's topic, that is functions of WBCs. We all know that WBCs are defensive cells of our body, and we have also discussed WBCs are divided in granulocytes and agranulocytes. Okay, granulocytes, they are neutrophil, eosinophils and basophils, and agranulocytes are lymphocytes and monocytes. Okay, we are starting with neutrophils. Now neutrophils, they are known as first line of defense for the organism when enters in our blood. Okay, and neutrophils, as they are granulocytes, so they have granules, and their granules, they contain certain enzymes like proteases, elastases, metalloproteases, metalloprotease, myeloperoxidase, and this all enzymes, they destroy microorganisms, as well as they also have defensins, and these defensins, they are antimicrobial peptides. Okay, membrane of the neutrophil, it contains NADPH oxidase. That is also important. We will discuss in detail the role of NADPH oxidase, which is having bactericidal action. Bactericidal means it causes destruction of bacteria. Bactericidal action. Okay, we will discuss in detail. Now, neutrophil, the structure, they are known as polymorphs because it has multiple lobe nucleus. You can see here diameter, as we all know. I'm not going in much detail. 10 to 14 micrometer diameter. It is stained. Granules are stained by both the dyes, so they are violet in color, and nucleus, the color is purple, and it is having multiple lobes. Lobes are from 2 to 6 depending on the maturity. Mature cell has more lobes, and it also contains sex chromatin that is present in 2 to 3% of neutrophils, and that is present in the females. And this gives drumstick appearance. You can see in this diagram drumstick appearance that is there. That is because of the presence of sex chromatin, and that is about 1 micrometer across, and it is attached to one of the lobe of the neutrophil. Now, cytoplasm of the neutrophil, that is pale as well as bluish in color, which is having fine granules, and the granules, they are stained by both acidic and basic dyes. Okay, therefore they are known as neutrophils. Okay, and these granules, they are lysosomal in origin. They are derived from the lysosomes, so they have degradation enzyme, lysosome, sorry. Okay, and they contain large amount of protein as well as lipids and nucleic acid. As well as these granules, they contain enzymes like, as we have discussed, some of the proteases, metalloproteases, myeloperoxidases, as well as glycosidase, sulfatase, phosphatase, nucleases, okay, proteolytic enzymes. Okay, and these granules also release histamine and peroxidase, and this help in killing the microorganism. Okay, now what is the kinetic lifespan and fat of neutrophil? Neutrophils, they are 50% of the neutrophils are there in the circulation, and 50% they are present in the marginal pool, means they are in the storage form. So total WBCs, total granulocytes, they are circulating plus marginal pool. Okay, and there is rapid exchange between these two pools, and they remain in the circulation following release from the marginal pool. For every neutrophil in the blood, we have 100 neutrophils in the bone marrow as reserve. Okay. Now, what are the functions? These are, as I told you, first line of defensive cells, and they act by phagocytosis. Phagocytosis means engulfment of the particle, engulfment of the foreign particle, whether it is bacteria or virus or anything. They are not concerned. They just cause phagocytosis. Also, they play an important role in the reaction of inflammation. Inflammation reaction, that is because of release of leukotriene, prostaglandins, thromboxane A2. Okay, and that results in all this inflammatory mediators. They cause vasodilatation, they cause increased capillary permeability, edema, and other reactions of inflammation, as well as they are also responsible for febrile response, increase in the temperature. And why increase in the temperature? Because they release endogenous pyrogens. Endogenous pyrogen. Pyrogen means pyrexia forming agent, that is pyrogen. Now, phagocytosis, how do they perform phagocytosis? Phagocytosis, as I told you, that is engulfment of the particle. For that, first of all, there is margination and pavementing. Margination means, you can see here, these are the neutrophils which are moving in the blood, and whenever there is microorganism here, they just move towards the, you can see here, near the end of the margin of the blood vessel, and they come out through the epididymis, squeezing through the uh, place between endothelial cells, and they come out. Okay, this is margination and pavementing. Then this is diapedesis, as I told you. Diapedesis, that is immigration of the neutrophil from blood. They pass through the, you can say that the place, the space between endothelial cells, and they come out of the blood vessel. Okay, the next is chemotaxis. Chemo means chemical, taxis means attraction. So chemical attraction of WBCs, that is chemotaxis, is mainly by, there are chemotactic agents. These chemotactic agents are released by the bacteria, viruses, or other inflammatory agents at the site of the inflammation. Okay. uh, okay, now you can see here, this is, you can see here, WBCs, there is diabetes, you can see here, there is chemotaxis. Okay, and increased permeability, that causes margination, pavement, and chemotaxis. Next step, that is opsonization. Now, what is opsonization? Here it is written, it is the process by which the microorganism pathogen is tagged for the ingestion and destruction by phagocytic cell. Means this pathogen that is tagged, now this is to be phagocytosed. So that process is known as opsonization, and opsonin are the antibodies against that particular bacteria or pathogen, and they coat, you can see here in this diagram, this pathogen that is coated by this bacteria. You can see here this one. So this is the process which is known as opsonization, and which is followed by phagocytosis. For opsonization, we have IgG, immunoglobulin G, opsonin. Okay, and this opsonin, as well as complement factor, they are also act as opsonin. Okay, and followed by phagocytosis, that is engulfment of the particle. You can see here, this is the phagocytosis process, that is engulfment. As we all know, that is pseudopodia they develop, and the pseudopodia, they enclose, they cover the phagocytic particle, and they that results in engulfment of the particle, and there is the formation of phagosome, phagolysosome, and there is degranulation. So these are all the processes. Okay, so lastly, there is killing or degradation stage, that is bactericidal agents. Antimicrobial or bactericidal agents, defense in alpha and beta, they cause degradation. What is the mechanism? You can see here, for that NADPH oxidase play an important role. You can see here, this NADPH oxidase that is present in the cell membrane, and this causes conversion of NADPH into NADP plus H plus, that is released, and because of that, certain superoxides are released, and they are responsible for the destruction of the bacteria. So this is oxygen dependent phagocytosis, bactericidal action, bactericidal action, and that is by oxidizing agent like superoxide O2 minus, you can see here, and hydrogen peroxide, these are produced. Okay, as well as neutrophils, they also discharge myeloperoxidase. You can see here in this diagram, myeloperoxidases are also released, and that causes conversion of uh, chloride, bromide, iodide, cyanide, they all are converted into the acids. Like chloride is converted into HOCl, HOBr, HOI. Hmm? And this all, they are potent oxidants, and that oxygen independent bactericidal mechanism, that also plays an important role in the destruction of bacteria. Now, a neutrophil, single neutrophil can phagocytose about 5 to 20 bacteria, and after that it gets inactivated, and kills the toxin also released from the bacteria, and that is also killed by the neutrophil. Now, this we have already discussed phagocytosis process. You can see here, first of all, there is opsonization and followed by phagocytosis. Okay, fine. And there is also pus formation. Pus that contains dead microorganism, dead bacteria, or any other microorganism, dead tissue cells, and our fighters also, dead WBCs also. They all form a pus. So this is a summary of all the this phagocytosis process. You can see macrophages moving towards bacteria, then bacteria being engulfed, phagocytosis. You can see pseudopodias that develop bacteria within the vesicle. Then lysosome binds with it, phagolysosome. So this is the action of macrophage as well as neutrophil. Macrophage when the organism is there in the tissue, and when the organism is there in the blood, neutrophils they perform the same action. Okay. Now, next is this we have already discussed. This also we have already discussed, phagocytosis. Now, variation in the count of neutrophil means whenever there is infection, inflammation, the neutrophil count increases, that is neutrophilia. Certain physiological conditions are also concerned with the increase in neutrophil count. They are during exercise, late stages of pregnancy, parturition, menstruation in newborn babies, in stressful situation, and epinephrine also increases neutrophil count. Pathological conditions are pus forming infection, viral infection, certain metabolic disorders, tissue damage like inflammation, myocardial infarction, injury, vaccines, poison. These are the common conditions. Other conditions also, if you can remember, that is fine. But otherwise, pyogenic infection, that is one of the very important condition in which there is neutrophilia. Then neutropenia, a decrease in the neutrophil count that causes are one is typhoid, paratyphoid fever, malaria, aplastic anemia, radiation, bone marrow depression because of certain drugs like chloromycetin, cytotoxic drugs, and repeated X-ray exposures, gamma radiation, certain chemicals like lead, arsenic, they also cause neutropenia. And physiologically in children also there is neutropenia. Then applied physiology, one that is neutrophil hypomobility means action of the neutrophil or mobility of the neutrophil decreases, and that results in decrease in the defensive action. Another applied aspect is congenital deficiency of leukocyte integrins, that also results in defect in the defensive action. Chronic granulomatous disease, here failure of generation of superoxide O2 minus in the neutrophil and monocytes, and by that they cannot kill the microorganism. There is deficiency of glucose 6 phosphate dehydrogenase, and this glucose 6 phosphate dehydrogenase, when it is deficient, that also results in failure of generation of NADPH. And when NADPH is not there, there is superoxide formation is also reduced. Myeloperoxidase enzyme, that is also required for bactericidal action. If its deficiency, that also results in decrease in the bactericidal action. Next small topic, that is Arnett count. What is Arnett count? That is counting number of neutrophil lobes, or counting number of neutrophils with different lobes. Means neutrophil with 3 lobes, 4 lobes, 5 lobes. Okay. So clinical significance is we can judge the rate of formation of neutrophil. You can see here left side shift means number of young neutrophil is increased, means number of neutrophils with 2 or 3 lobes are increased. Okay, so there is presence of younger cells, and shift to right, there is presence of the mature cells. You can see here. Okay. Now shift to left means more younger cells. You can see this is the normal percentage. You can see now 1 lobe, 2, 3, 4, 5. You can write down this also: 5 to 10%, 20 to 30, 40 to 50, 10 to 15, and 3 to 5. When left shift is there, N1 plus N2 plus N3, normally this is 80%, but when it is more than 80%, you can say that this is left shift, and that indicates that bone marrow is hyperactive, increased production of the young neutrophil. Right shift means when N4 plus N5 is more than 20%, and that indicates hypoactive bone marrow, means bone marrow produces less amount of young cells, so you can say that old cells are increased. Next cell is eosinophil. The size of cell is 10 to 14 micrometer. Nucleus, that is purple in color. It has 2 lobes, spectacle shaped nucleus. Okay, and cytoplasm contains granules. These are acidophilic granules, and the granules are coarse granules, and they may stir the nucleus. You Okay, so these are the granules of eosinophil. Granules, they contain certain substances like histamine, lysosomal enzymes, also contain eosinophilic chemotactic agents for anaphylaxis, also contain major basic proteins. Okay, they all are present in the granules of the eosinophil. Now, what are the functions? Eosinophils are not much phagocytic, but their function is they cause release substances which are lethal for the parasitic infection. Okay, infestation, mainly parasitic infestation. Okay, they release major basic proteins which are larvicidal peptide. Larvicidal means they cause destruction of the larva of parasite. Okay, as well as they also release eosinophilic cationic protein which is having bactericidal action, and mainly they destroy helminth, that is also a parasite, helminth. Okay, eosinophilic peroxidase are also there. They also destroy helminth, parasite, as well as tumor cells. They also play an important role in allergic reaction because they release certain mediators which are important for allergic reaction. Okay, histamine, heparin, and all. Also play an important role in immunity. They present in large amount in the digestive tract, and they provide mucosal immunity. Eosinophils, they attack on the parasite that are too large to be engulfed by phagocytosis. Okay, and eosinophilic granules, they release the chemicals, and these chemicals which are toxic to the larva of the parasite. So always in case of parasitic infection, your eosinophil count is increased. So what are the causes of eosinophilia? Means increased eosinophil count. That is allergic condition like asthma, blood parasitism when parasite count increases, skin disease also, and eosinopenia means decreased count, that is found in steroid therapy or if you have given the injection of ACTH, because ACTH increases release of cortisol, and cortisol causes decrease in the eosinophil count. Next cell, that is basophil, size is same, 10 to 14 micron diameter, nucleus is bilobed. Again, you can see here sometimes it may be trilobed, and nucleus, that is S-shaped, and the granules, they are ink blue in color. You can see. So they are known as basophil. Granules are again codes like eosinophils. Okay, and cytoplasm contains, as we have discussed, blue in color, basophilic, and codes granule are there. And the granules, they release histamine, heparin, 5-hydroxytryptamine, eosinophilic chemotactic factor A. Okay, these all are released. Basophils, they are also important for healing as well as allergic reaction. Okay, basophils, they have IgE receptors on which you can see here. These are the basophils. You can see here they have IgE receptors. So when IgE, here these are the IgE, immunoglobulin E, to which reagent means allergen binds, and when allergen binds with the IgE, there is rupture of the membrane of your basophil, and the substances of allergic reaction, they are released. Okay, and the granules, they contain histamine, as we have discussed, heparin, hyaluronic acid, cytokines, proteases, and myeloperoxidase. So they have important role in the allergic reaction. Okay, also they play an important role in the prevention of spread of allergic inflammatory process. Okay, why? Because they release eosinophilic chemotactic factor A. Okay, and that is important for hypersensitivity reaction. And what do they do is they cause phagocytosis of antigen antibody reaction which is produced at the time of allergy. Now, also they release heparin. What is the role of heparin? Heparin is an important anticoagulant, as well as they activate the enzymes lipoprotein lipase, and this removes fat particles also after fatty meal. Then basophilia, increase the basophil count above 100, absolute count 100 per cubic millimeter. That is found in the viral infection like smallpox, chickenpox, and influenza. Allergic condition in chronic myeloid leukemia in case of polycythemia vera, and basophilpenia, that is decrease in the basophil count, commonly found in the corticosteroid therapy, drug-induced reaction, and after the pyogenic infection. Next is mast cell, that is the cell present in the tissue. It resembles to basophil, that is present in the bone marrow, that is present in the connective tissue, epithelial tissue, okay, and that is found immediately outside the capillaries in the skin, and they do not enter in the circulation. They have, again you can see IgE receptor. When IgE binds here, IgE and allergen, and this is IgE's reagent. When this complex is found, that causes degradation of the cell membrane and release of the substances for the allergic reaction. Next is lymphocytes. Lymphocytes are again of two types, large lymphocyte and small lymphocyte. Large lymphocyte size, that is similar to WBC 10 to 14 micrometer diameter, and small lymphocyte 7 to 10 micrometer diameter. T lymphocytes, they are processed in the thymus, so they are known as T lymphocytes, and they are concerned with the cell mediated immunity. I have discussed in detail that in my topic of cell mediated immunity. You can go to that video. And B lymphocytes, they are responsible for humoral immunity. Okay. Here, morphology, they have, lymphocytes have scanty cytoplasm and no visible granules are there. Nucleus is large and single, and it is present in the center. It stains blue very deeply, giving ink spot appearance. And nuclear chromatin, that is coarsely clumped, and shapeless nuclear chromatin may be present. Okay, lymphocytosis, that is the condition in which lymphocyte count increases. Physiologically, it is found in infants and young adult and females during menstruation. And pathological causes for lymphocytosis, that is in chronic infection like tuberculosis, hepatitis, whooping cough, and viral infection, as well as autoimmune disease, because antibodies are produced. So lymphocyte, they produce, B lymphocytes, they produce antibodies. Infectious mononucleosis and lymphatic leukemia, lymphocyte count increases, whereas lymphocyte count decreases after steroid therapy. Hypoplastic bone marrow has reduced its function. Irradiation, patient on immunosuppressive treatment, immunity antibody production decreases, and acquired immunodeficiency syndrome. Monocytes, largest cell in the circulation, size is about 12 to 20 micrometer diameter. Granule cytoplasm is abundant, pale blue in color. You can see here, not properly shown. Here, this is monocyte, okay, and sometimes it contains purple dust like granules. These are known as orophilic granules. And nucleus is large, single. It is eccentric, not in the center, and it is indented, kidney shaped nucleus or horseshoe shaped nucleus is present, okay. And this kinetic lifespan and fat of monocyte. Monocyte remains in circulation, and that is about 10 to 20 to maximum 72 hours. Okay, and after that it enters into the tissue and it forms tissue macrophages. And once they become tissue macrophages, they will not re-enter in the circulation. And function is, it plays an important role in the defense mechanism. It has also phagocytic activity. It can kill as many as 100 microorganisms. Okay, also can kill tumor cells after sensitization by lymphocyte. Also, it causes synthesis of the complement and biologically important substances. Monocytosis, increase in the monocyte count found in the bacterial infection like tuberculosis, syphilis, subacute bacteria, endocarditis, in infectious mononucleosis after viral infection, and protozoal and rickettsial infection. Whereas monocytopenia, that is rare condition which is found after in hypoplastic bone marrow. So, another is leukaemoid reaction. What is this leukaemoid reaction? You can see here, there is leukocytosis that is found. There is increase in the leukocyte count. Okay, reactive excessive leukocyte count is found that resembles to leukemia, but leukemia is not present. Okay, and it is of two types. Either myeloid series increases, that is known as myeloid leukaemoid reaction, and lymphoid series increases, that causes lymphoid leukaemoid reaction. So this is all about today's topic, that is function of leukocytes. Okay, if you wish to get all my notes in soft copy, download the application Vesalius from Play Store and get the subscription. And for hard copy, you can order my book, that is Physiology Notes, available on Flipkart and Amazon. Thank you so much. If you like my video, you can like it, you can share with all your friends, and subscribe my channel. Thank you.